New Zealand has officially recorded more than 1 million cases of COVID-19. It's taken just 3 months for us to leap from less than 20,000 to the million mark, and experts say the real scale of our outbreak could be far larger than what we think.
Pretty much anywhere around the world, we've seen that the reported cases are a small fraction of the actual infections out there. There's might be 2 million infections or more in total out there, and so that would be 40% of the population possibly have been infected by this point, which is a lot.
We had 2 main spikes of Delta seen here and here. But it was only when Omicron hit our shores that things really took off. Omicron proved a game changer as our 7-day rolling average of case numbers surged just over 20,000, turning our Delta outbreaks to merely a blip on the timeline.
With Omicron arriving, the whole strategy had changed. The government really focused only on trying to stop the health system being overwhelmed. And so every case still matters to the people who are infected, but at a societal level, we came to accept that more cases would be out there, and hence people were much less careful. People were going about their business, and it was spreading widely.
Although the number of infections were mostly made up of people who had been vaccinated, experts say the vaccine still made an impact in keeping the number of hospitalisations relatively low.
Following initial spikes, hospitalisations have come down dramatically, and we're at less than 9,000 total since the pandemic began, as at this week.
Here in New Zealand, we've seen quite a lot of deaths, but we haven't seen the morgues overflowing. We haven't seen the hospitals completely overflowing. Whereas in Hong Kong, people couldn't get into a hospital. They were using trucks to store bodies. And many times more deaths for the number of cases, and that really came down to having an effective vaccine here and having very widespread coverage for the first 2 doses.
But with constant word and warning of new variants, what can we expect for the future?
We've seen multiple waves of different variants. And that seems to be the picture we've seen over the last couple of years. We see a new variant come along that can either transmit much faster or evade immunity. And we see the effects of waning immunity in people. And so both of those things can cause new waves. Other countries have seen 4, 5, even 6 large waves occur. We've had 1. We seem to be, between waves at the moment, and it's a question of, when the next one will come along.
Thanks for checking out our YouTube channel to stay up to date with all the latest news from the New Zealand Herald. Click the subscribe button below, or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.